Hypothyroidism, or underactive thyroid, happens when the thyroid gland doesn't make enough hormones. These hormones are important because they help control the body's metabolism, which is how our body uses energy. When thyroid hormone levels are too low, it can cause many different symptoms, like feeling tired, gaining weight, or having trouble thinking clearly. The thyroid is a small, butterfly-shaped gland located in the front of the neck. It affects almost all parts of the body, including the brain, heart, and digestion. In this video, we'll talk about some common signs of hypothyroidism. We'll also cover what can happen if it's not treated, how common it is. Signs and symptoms of hypothyroidism. Underactive thyroid. Thyroid hormones control many functions in the body, so thyroid problems can cause a variety of symptoms. If you're experiencing any symptoms, they could be related to a thyroid issue. However, having one of these symptoms doesn't always mean you have a thyroid problem. It's important to talk to a healthcare provider to get the right diagnosis. Changes in mood and memory. People with untreated hypothyroidism often experience changes in mood and memory, such as anxiety, depression, a lack of interest or indifference, trouble remembering things, difficulty focusing and paying attention, feeling down or low, slower thinking and speech. These happen because the brain needs thyroid hormones to work properly. Studies show that low thyroid hormone levels can change the brain structure and how it functions. Fortunately, these changes can improve once treatment starts. Tiredness and fatigue. Feeling extremely tired is a common sign of hypothyroidism. Many people with this condition feel so worn out that it's hard to get through their day. This tiredness happens no matter how much sleep they get or how often they nap during the day. Treatment for hypothyroidism usually helps improve energy levels and daily activity. Lump or swelling in your throat. If you notice a lump in your throat or changes in your voice, it might be related to a thyroid problem. Sometimes, a lump called a thyroid nodule grows in the thyroid gland. Most nodules are not cancerous, but some can be. The thyroid can also become enlarged, making your neck look swollen. This condition, called a goiter, can be caused by either too much or too little thyroid hormone. A lump in your throat could also mean other thyroid issues. Thyroid cancer might cause a lump and can also lead to trouble breathing or swallowing, pain when swallowing, or a hoarse voice that doesn't go away. Swelling or inflammation of the thyroid gland might be a sign of thyroiditis. Hashimoto's disease, a common type of thyroiditis, is a frequent cause of hypothyroidism. Thyroiditis can also happen after having a baby, known as postpartum thyroiditis. Muscle problems. Sometimes, if you push yourself too hard in a workout, your muscles might feel sore. But if you notice sudden or unusual muscle changes, it could be a sign of thyroid disease. When the thyroid is overactive, hypothyroidism, it can lead to muscle weakness and tenderness, especially in the shoulders and hips. On the other hand, if the thyroid isn't making enough hormones, hypothyroidism, you might experience muscle or joint pain. About 80% of people with hypothyroidism have muscle pain or weakness, which can become severe if not treated and might limit movement. It's not entirely clear why thyroid problems affect muscles, but some studies suggest that a lack of thyroid hormones can damage muscle cells, causing pain and weakness. Pregnancy issues. Thyroid problems can affect your menstrual cycle and ovulation, making it harder to get pregnant. If you have hypothyroidism, it can lead to high levels of prolactin, a hormone that affects milk production and can stop ovulation. Thyroid disease can also impact the health of your pregnancy. Pregnancy hormones need to increase thyroid hormone levels to support the baby's brain development. If thyroid disease is not treated, it can lead to complications such as low birth weight, miscarriage, preeclampsia, a condition that causes high blood pressure during pregnancy, premature birth, heart issues. Heart palpitations are when you feel like your heart is fluttering, skipping beats, or beating too fast or too hard. You might notice this feeling in your chest or in your neck and throat. Thyroid hormones are important for heart function. If you have too much thyroid hormone, hypothyroidism, it can cause your heart to beat rapidly. About 10% to 25% of people with hypothyroidism experience a fast heartbeat. On the other hand, if you have too little thyroid hormone, hypothyroidism, it can affect your heart in different ways, such as narrowed blood vessels, swelling from fluid retention, high blood pressure, high cholesterol levels, slow heart rate. If these symptoms are not treated, they can lead to heart failure. Constipation. Hypothyroidism can slow down digestion. When the thyroid isn't working properly, it can affect how the stomach, small intestine, and colon move food through the gut, leading to constipation. Doctors usually define constipation as having fewer than 3 bowel movements a week. It can also mean having hard stools, difficulty passing stool, or feeling like you can't completely empty your bowels. Weight changes. Thyroid hormones control metabolism, so thyroid problems can lead to weight changes. Hypothyroidism often causes weight gain because a slower metabolism makes it easier to put on weight, though extreme weight gain is rare. On the other hand, hypothyroidism usually leads to weight loss because an overactive thyroid speeds up metabolism. The amount of weight loss depends on how severe the hypothyroidism is. A slightly overactive thyroid will cause less weight loss than a very overactive one. Sleep problems. Thyroid problems can lead to various sleep issues, such as insomnia, restless leg syndrome, and obstructive sleep apnea. Untreated thyroid disorders can make these sleep problems worse. Here's how thyroid issues can affect your sleep. Insomnia, too much thyroid hormone, hypothyroidism, can make it hard to fall asleep or stay asleep. It can also worsen anxiety and depression, which affect sleep. Hypothyroidism doesn't directly cause insomnia, but it can make sleep quality worse due to discomfort from muscle and joint pain. Obstructive sleep apnea. Many people with obstructive sleep apnea also have hypothyroidism, but the connection between these conditions isn't completely clear. Restless leg syndrome. Both hypothyroidism and hypothyroidism can contribute to restless leg syndrome. Treating thyroid issues may help improve these symptoms. Skin, nails, and hair changes. Thyroid problems can lead to various issues with your skin, nails, and hair. Skin and nails. Nails may become brittle, dry, thick with ridges, or change in growth speed. You might notice curved, swollen fingertips, deep lines on your palms and soles, or discolored skin. Skin can become dry, pale, itchy, or develop rashes, especially in creases. Nails might peel, crumble, or break easily, and wounds may heal slowly. You could also sweat more or less than usual or see a widening nose. If you have skin conditions like vitiligo, hives, or alopecia areata, you might be at higher risk for thyroid disease. Hair may become coarse, dull, dry, and brittle, leading to breakage. You might experience changes in hair growth rate, hair loss, bald patches, or a dry, itchy scalp. Hair might shed more, be softer and finer, or thin out, including on the outer edge of your eyebrows. If you're losing more hair than usual, it could be due to various factors like childbirth or excessive use of hair products. It's best to see a healthcare provider to find out the cause. Menstrual changes. If you have an underactive thyroid, you might notice changes in your menstrual cycle, like heavier or irregular periods, or spotting between periods. Hypothyroidism can cause these issues because it affects other hormones involved in menstruation by slowing down the breakdown of estrogen, reducing the levels of sex hormone binding globulin. High cholesterol. Thyroid hormones help the liver remove excess cholesterol from the body. When thyroid hormone levels are low, the liver has a harder time doing this, which can lead to higher cholesterol levels. Studies show that up to 13% of people with high cholesterol also have an underactive thyroid. Because of this, doctors often test for thyroid problems in people with high cholesterol. Treating an underactive thyroid can help lower cholesterol levels, sometimes even without the need for cholesterol-lowering medications. The bottom line: it can be hard to diagnose a thyroid disorder because its symptoms are similar to those of other health issues. An overactive or underactive thyroid can also cause different symptoms. Being aware of signs like irregular periods and mood changes can help you get the right treatment. If you think you might have a thyroid problem or have a family history of thyroid disease, watch for changes in your appetite, fatigue, constipation or diarrhea, trouble getting pregnant, or dry skin. Let your healthcare provider know if you're worried about thyroid issues. Thank you for watching. If you found this information helpful, please subscribe to our channel for more tips and updates. Wishing you good health, wealth and happiness.